10 possible effects of smoking cigarettes. Smoking cigarettes can have many adverse effects on the body. Some of these can lead to life-threatening complications. In fact, according to the Centers for Disease Control and Prevention trusted source, smoking cigarettes increases the risk of dying from all causes, not just those linked to tobacco use. Smoking cigarettes affects the respiratory system, the circulatory system, the reproductive system, the skin, and the eyes, and it increases the risk of many different cancers. Number 10. Lung damage. Smoking cigarettes affects lung health because a person breathes in not only nicotine, but also a variety of additional chemicals. Cigarettes are responsible for a substantial increase in the risk of developing lung cancer. This risk is 25 times greater for men and 25.7 times greater for women trusted source. The CDC report that roughly 9 out of 10 trusted source lung cancer deaths is linked to smoking. Smoking cigarettes also presents a greater risk of developing and dying from chronic obstructive pulmonary disorder (COPD). In fact, the American Lung Association report that smoking causes 80% of COPD deaths. Cigarettes are also linked to developing emphysema and chronic bronchitis. They can also trigger or exacerbate an asthma attack. Number 9. Heart disease. Smoking cigarettes can damage the heart, blood vessels, and blood cells. The chemicals and tar in cigarettes can increase a person's risk of atherosclerosis, which is the buildup of plaque in the blood vessels. This buildup limits blood flow and can lead to dangerous blockages. Smoking also increases the risk of peripheral artery disease (PAD), which occurs when the arteries to the arms and legs start to narrow, restricting blood flow. Research shows a direct link between smoking and developing PAD. Even those who used to smoke face a higher risk than people who never smoke. Number 8. Fertility problems. Smoking cigarettes can damage a female's reproductive system and make it more difficult to get pregnant. This may be because tobacco and the other chemicals in cigarettes affect hormone levels. In males, the more cigarettes a person smokes and the longer they smoke for, the higher the risk trusted source of erectile dysfunction. Smoking can also affect the quality of the sperm and therefore reduce fertility. Number 7. Risk of pregnancy complications. Smoking can affect pregnancy and the developing fetus in several ways, including increasing the risk of ectopic pregnancy, reducing the baby's birth weight, increasing the risk of preterm delivery, damaging the fetus's lungs, brain, and central nervous system, increasing the risk of sudden infant death syndrome, contributing to congenital abnormalities such as cleft lip or cleft palate. Number 6. Risk of type 2 diabetes. The CDC report that people who smoke regularly have a 30-40% higher risk trusted source of developing type 2 diabetes than those who do not. Smoking can also make it more difficult for people with diabetes to manage their condition. Number 5. Weakened immune system. Smoking cigarettes can weaken a person's immune system, making them more susceptible to illness. It can also cause additional inflammation in the body. Number 4. Vision problems. Smoking cigarettes can cause eye problems, including a greater risk of cataracts and age-related macular degeneration. Other vision problems related to smoking include dry eyes, glaucoma, diabetic retinopathy. Number 3. Poor oral hygiene. People who smoke have double the risk trusted source of gum disease. This risk increases with the number of cigarettes a person smokes. Symptoms of gum disease include swollen and tender gums, bleeding when brushing, loose teeth, sensitive teeth, Smoking tobacco can limit a person's ability to taste and smell things properly. It can also stain the teeth yellow or brown. Number 2. Unhealthy skin and hair. Smoking tobacco can affect a person's skin and hair. A person who smokes may experience prematurely aged, wrinkled skin. They also have a high-risk trusted source of skin cancer, especially on the lips. Smoking can cause the hair and skin to smell of tobacco. It can also contribute to hair loss and balding. Number 1. Risk of other cancers. In addition to the well-documented link with lung cancer, smoking cigarettes can also contribute to other forms of cancer. The American Cancer Society report that cigarette smoking causes 2,030% trusted source of pancreatic cancers. People who smoke are also 3 times as likely trusted source to develop bladder cancer than people who do not. Smoking cigarettes can also double a person's risk trusted source of stomach cancer. Tobacco is especially linked to stomach cancers that occur near the esophagus. Cigarettes can also increase the risk of mouth cancer, laryngeal cancer, throat cancer, esophageal cancer, kidney cancer, cervical cancer, liver cancer, colon cancer, acute myeloid leukemia,